Well, if you've ever known someone who's been through corrective limb treatment, or if you've even been through this yourself, you already know that it's a long and very difficult process. And even after surgery, patients have to regularly tighten pins connected to their bones with a stabilization device. But now, and for the first time ever, an Israeli robot has just stepped in and effortlessly done this job all by itself.
A 15-year-old boy in Jerusalem is the world's first patient to have a bone deformity corrected through this cutting-edge and fully automated system. To illustrate what a breakthrough this is, let me explain how this process has worked until now. After undergoing corrective bone surgery, the limb is usually fitted with a kind of stabilizing cast rigged with a series of metal rods that press deep into the bone. These rods need to be tightened every day by hand with a highly precise series of turns, and sometimes this needs to be done for months on end. As you can imagine, this process is not always pleasant, and because of the accuracy it requires, doing it wrong can even cause worse problems or result in further surgeries. That's where an Israeli startup called Orthospin enters the equation. Orthospin came up with a revolutionary new robotic system that takes regular readings in the affected region of the limb and tightens the pins accordingly totally on its own. This promise is probably why the teen's family took the chance and gave the robot its first true human trial. Doctors studied the x-rays closely and were both parts amazed and relieved to discover that the system was working perfectly. But the truest proof came when finally, at the end of a long process, the cast finally came off and the teenager took one look at his leg, exclaiming, quote, "See how my leg looks normal." Needless to say, hopes are very high that other patients may soon be saying the exact same thing.